Hello people, in this video let us look at tuberculosis of the bone, that is osteomyelitis, tuberculous osteomyelitis you can say. So basically who is the problem here? This bacteria, Mycobacterium tuberculosis bacterium, which here you can see in the Zn stain they are showing you how they are like pink and beaded kind of appearance, and here they are showing you in some fluorescent kind of a thing, right? Oromine phenol staining. Anyway, so tuberculosis is caused by this bacteria, Mycobacterium tuberculosis. It can also affect your bone. How? By going via blood and all, it will reach your bone and affect your bone, okay? So there will be some cold abscess, pus and all sitting inside your bone, right? And then that bone can get destroyed. You can see that this pus can discharge, right? And that can form a sinus on your skin, etc. So this is what and all they are calling cold abscess word they are using. So what and all can this bacteria affect? It can affect your spine, okay, most commonly your spine, okay, touch your spine. Tuberculosis bacteria can come and affect that, okay. How does it reach this spine? Mostly via blood supply, or it can even come directly, okay. So can reach via the blood or directly it can come, and it will affect your spine. It can affect your hip, okay. Hip means your upper end of femur it can affect, right. Then it can affect knee. So your lower end of femur and tibia, all that it can affect, okay. Mostly you'll have to learn these individual things in separate videos. In this video we will focus only on the spine, okay. This spine is TB spondylitis, okay. TB osteomyelitis of the spine is also called as TB spondylitis or Pott's spine, okay. So in this what will happen, the intervertebral discs, these discs will get involved, okay. They will get destroyed, the disc. Actually first it will affect the vertebral body. Obviously where is the bacteria going? It's going to the vertebral body, right. So first it will affect this vertebral body, and then this intradisc also there will be disc also will get affected, and then so finally inside whatever spinal cord is there, right, finally spinal cord will get affected, and then the nerve, that's what your spinal cord gets affected. That is when it will cause Pott's paraplegia. That is, this guy will have paralysis of the lower limbs both, okay. So that will become paraplegia. So all this we'll look at in this video, okay. We will not look at hip and knee and all. What are we looking at in this video? Only Pott's spine, okay. Pott's spine we'll look at this video, and we'll also look at Pott's paraplegia, okay people. In this video, let's look at the types of tuberculous spine, okay. So basically tuberculosis can lead to osteomyelitis. When it affects the spine, it is called as what? Pott's spine. Say it, Pott's spine, tuberculous myelitis of the spine. Very good. Now, in this we are looking at the types of tuberculous myelitis of the spine, okay. So how does it affect the vertebral column, okay. So what you have understood is that it will first affect the vertebral body. That is, it is not affecting the disc. It is affecting what? The bone itself, okay. So somewhere here, let us say it will affect. It's not affecting the disc, it's affecting the vertebral body, vertebra it is affecting first, okay. And because the blood supply to two adjacent vertebrae is shared, so it will affect both, okay. So you will have something like this. So this is the first type you should know. The first type is called as paradiscal. Paradiscal means what? Look at this. This is the commonest type. In this, the contiguous area of two adjacent vertebrae along with intervening disc are affected. So the middle disc also is affected, the vertebra, adjacent vertebra also are affected. This is paradiscal. This is the most common type. Did you understand? Most common type, have you understood of what? Of vertebral tuberculosis. Okay, so did you get the first type? What is the first type, people? Paradiscal, very good. Now let's go to the second type. Second type is central, okay. Now central, are you seeing here? This is the central. So you can see the center of the vertebral body. In this type, only single vertebra is affected, okay. The body of single vertebra is affected. So this can lead to early collapse of the weakened vertebra. This can lead to the collapse of the vertebra, okay. So what types of collapse are there? You have wedging collapse or concertina collapse, okay. But wedging collapse, you remember, is most common, okay. So let me show you a photo of the collapse. So here they are showing you types of collapse of vertebra, okay. So now can you tell the second type that we have studied? First type in tuberculous osteomyelitis of the spine is also called as Pott's spine. In the first one you saw paradiscal, you saw, what was the second one? Central, right? That central, the body is affected, right? Central you have seen, in which there can be early collapse. After central, they are showing you anterior, posterior. So remember, this is anterior and this is posterior. So what and all you saw? Paradiscal, central, anterior, posterior. Now look at anterior. Shall we look at anterior, people? Very good. So now look at anterior here. In this type of infection, it is localized to the anterior part of the vertebral body. The infection spreads up and down the anterior longitudinal line. This is anterior type of tuberculosis of the spine. Very good. Now look at this last one here, posterior. Very easy for us. Posterior. Posterior, what is affected? Posterior part of the vertebra is affected. So what and all is there in the posterior part of vertebra? Do you know the parts of vertebra first of all? Okay, so here what and all is affected is the pedicle, lamina, spinous process, transverse process. Okay, so the pedicle, lamina, spinous process, transverse process is affected. So where can you see the spinous process? Is here at the back. Yes, posterior we understand. So this is spinous process, lamina, you understood what is lamina. Then pedicle is connecting the body, and this part looks like transverse process is here. Horizontally out both the sides, left lateral and lateral. Yeah, laterally. So did you understand all these parts are affected in what? Posterior tuberculosis of the vertebrae. Very good. So you are done with all the types of Pott's spine. Okay. See, tuberculosis will not just affect the spine. Okay, it can affect your femur, etc., etc., etc. Here we are looking at the types of vertebral tuberculosis. You have the paradiscal, central, anterior, and posterior. And look at this tuberculous osteomyelitis of the spine. So basically, there will be collapse of the vertebra. There will be disc prolapsed disc. They have shown you. Please focus on these terms. You have to write in the example: collapsed vertebra, prolapsed disc, and there will be compression. This person can go into paraplegia. There can be cold abscess here. Okay, without any obvious signs of inflammation, like it won't be hot or red, etc. There can be cold abscess which you may have to drain. It can lead to psoas abscess, that is the psoas muscle, right? So those psoas muscle, etc. So basically from here it can spread the spine. Let's say from here it can spread to the muscles, and muscles can get abscess, that is psoas abscess, and all can happen. Healing can happen, but it will lead to fusion of these vertebral bodies, right? And there can be some permanent shape change in these people. Okay. And then these abscesses, whatever we spoke of, right? These abscesses, they can burst out via the skin, and you can see sinus on the skin. Okay. So that is also possible. So all that is about tuberculous spine. What will you see in the microscopy in these? You will see this caseous necrosis, right? That's what they are showing here. So you will see the caseous necrosis, the epithelioid, you will see the epithelioid cells, you'll see the giant Langerhans cells, etc. Standard granuloma of tuberculosis you will see. Okay. Guys, so tuberculosis will affect a lot of bones. Okay, so we told you that it will affect the spine, most important. Then it can affect the hip, the knee joint, the femur. Hip and femur are same, right? Okay, so all this it can affect. Okay, so each of this topic can be a separate topic for you, like Pott's spine, tuberculosis of knee, tuberculosis of hip. All these are separate topics. In this video, we have only looked at the types of tuberculosis spine or Pott's spine. Okay, that is the paradiscal, central, anterior, and posterior. Now let us go to the management. Okay, what are we looking at? Management of Pott's spine. Okay, so you will call this guy, and what and all you will do for this guy, you will take an X-ray of the spine. Okay, so what and all you will see in that, you will see that there is reduction in the disc space, right? And then you will see that there is destruction of the vertebral body. You can only think, you will see cold abscess, you will see rarefaction. What is rarefaction? You will see that the density of this is reduced of the vertebra, right? And then if it is anterior, you will see erosion in the anterior part. And if it is posterior, you will see erosion in the posterior ligaments. Very good. And if there is healing, you will see some sclerosis, right? Instead of X-ray of the spine, if you do a CT spine, how will it be? You can see the abscess and all better. And you may also want to take a biopsy, and you might want to culture, etc., etc., and find out if it is this Mycobacterium tuberculosis bacteria which is causing all this problem. This you can write, right? You can write all this acid fast staining, Zeal-Nielsen staining, and finding out whether the organism is Mycobacterium tuberculosis. Very good. Then you will do standard tests, ESR, ELISA. You will check for antibodies, chest X-ray to know if there is pulmonary tuberculosis, Mantoux test to check the sensitivity, resistance of this person. Okay. So all these are the investigations of Pott's spine. Now that you did the investigations, you should also rule out the other conditions that may cause this kind of a spine condition. Okay, so what are the differentials for Pott's spine? So differentials for Pott's spine are just based on the pain. What are the differentials that you can come up with that they have written here? right? Based on the pain, what differentials can be there, and based on the neurological deficits, what differentials can be there. Pain, some trauma this guy has had, so he has back pain. Maybe he has some myeloma, secondaries in the bone, right? That's why he's having some back pain. Guys, focus. This guy has back pain. Touch your back and think, oh, there's a trauma here at the back. There's a myeloma. There's a prolapsed disc or ankylosing spondylitis, which is causing back pain for this guy. Okay, so those are the DDs for back pain. Now coming to the DD for neurological deficit. Okay, so basically that you're thinking, what can cause this neurological deficit? Touch the spine and see. Maybe there is a tumor here. Oh, maybe there's a tumor here. Okay, not the chair, my back, my spine. So why do you think I'm having neurological deficits? My nerves and all are acting up. Why? Because of there's some spinal tumor, probably tumor, and again trauma also they're saying trauma, tumor, and again secondaries of spine. Same thing, only they're writing again and again. Trauma, tumors, secondaries of spine. Here also they wrote trauma. But here they didn't write, secondaries they have written. Prolapsed disc, ankylosing spondylitis, they have written for pain. Okay. So that's all about the differential diagnosis for POTS spine. Okay. Differential diagnosis for POTS spine over. It could be some tumor, trauma, secondaries, what else? Ankylosing spondylitis, what else? Some important point. Trauma, I told. Tumor, prolapsed disc. Okay. Now let us go to the treatment of POTS spine. POTS spine, you will give ATT. That is nothing but your anti-tubercular drugs. That is what? Rifampicin, isoniazid, ethambutol, and pyrazinamide. Very good. HRZE, HRE. Write all that. Okay, you will write, right? You have to expand all this and write. What is it? HRZE for 2 months and HRE for 4 months. This is standard treatment you will write for the drug sensitive case. Then you will tell them to take rest because it's a spine issue. And then you will give them something called as a Minerva Jacket or collar. If the cervical spine, the neck, if it is affected, then you're giving them a Minerva Jacket or collar. This Minerva Jacket looks like something like it's a whole life jacket kind of a thing. Whole thorax, chest they are wearing. Okay. Then you will treat the cold abscess, you will aspirate it, you will evacuate the abscess, pus, etc. Okay. So all these are the options for treating POTS spine. So how will you treat POTS spine? Come on, say, I will give them drugs to treat tuberculosis. Very good. Then I will drain this cold abscess, etc. Very good. Then I'll tell them to take rest. I'll give them some Minerva Jacket and collar so that they don't move a lot. Very good. Very good. Now, let's just move on one step ahead. Okay. Now, let us say this person is having neurological deficit, etc. They're having paraplegia. What do you mean by paraplegia? He's not able to use both his lower limbs. Okay. There's some problem with the nerve supply to this both the limbs, lower limbs. Guys, we have gone one step ahead. Okay, we are talking about POTS paraplegia. The spine, yes, was affected. Yes, we know all that. POTS spine over. Now, spine has led to one more problem now. Neurological problem. Now, the nerve is affected. Let's use yellow for that. The nerve is affected. Now, what is it called? POTS paraplegia. Both lower limbs are not working properly. Okay, so he's not able to, he's paralyzed, lower limbs, both the lower limbs. So this is POTS paraplegia. How did it come? Because of POTS spine only it came. So that's why they're continuing this name, POTS paraplegia. Why is it called POTT? Okay, anyway, so in this what and all you will see now, the neural tissues will be edematous. Okay, so there will be edema here. So it's all inflamed. Okay, so the neural tissue, we're talking about the nerve here, it's inflamed. There is extradural pus and granulation tissue. So there is extradural pus and granulation tissue. For pus, we'll use which color? We'll use actually a very dirty brown we should use. Pus and granulation tissue. Okay. So what will happen? There is, because of all this, there is compression. Okay. You can see here there is an internal gibbous which has come. This is pushing this anterior wall of the spinal canal. Can you see how it has got pushed? So the nerve is getting affected here. So there is angulation of the diseased spine. Okay, and this will cause the bony ridge on the anterior wall of the spinal canal. So you can understand the nerve is getting compressed here, kind of thing, right? So this is this internal gibbous. You have to draw this diagram if they ask you in the exam about internal gibbous. Okay, this is what is causing what? The POTS paraplegia. So you may see some sequestra. So you may also see some infarction of the spinal cord. That is tissue death, right, is happening here. Probably because of ischemia or this compression. So basically what and all you'll see sequestra. Sequestra is all that osteomyelitis, right? The diseased bone. Infarction of spinal cord you can see, right? Then what else can you see? This infarction of the spinal cord is actually leading to the paralysis. Okay, understand this. This is the one they are saying is actually leading to the paralysis, infarction. So there's death of this tissue, spinal cord. Not entire thing, wherever this is getting compressed. So these people may have a granuloma, okay. So extradural granuloma can be there. So that may mimic some kind of a spinal tumor. So that's why they are calling this condition as a spinal tumor syndrome, okay. Why are they calling this as a spinal tumor syndrome? Because there could be extradural granuloma, which gives the clinical picture of a spinal tumor. But is it a spinal tumor? No, it's just a granuloma, because tuberculosis is causing a granulomatous disease. Very good. Okay, so you have in POTS paraplegia, you have two types. You have the early onset paraplegia. Early onset paraplegia during the active phase of the disease, and late is several years after the disease. Let us see what we know in early. Early, what will be there? Abscess will be there. We know this. Sequestra we mentioned. Okay. Degenerated disc, infected disc, infective something. Okay, all this we know, right? Early. Late, what will happen? Late, they are talking about that internal gibbous and then the severe kyphosis. See how this guy is bent, right? So there is like a kind of a deformity. Fibrous septae will be there following healing. Okay, so this is about late paraplegia. But here again they seem to be talking about the spine. This is more like of a spine kind of a thing. But paraplegia should talk about the neurological stuff, right? So what will be the late onset paraplegia? So this paraplegia is appearing late, is it? And early onset paraplegia occurs within 2 years of the active disease. Okay, so the paraplegia is appearing late and the paraplegia is appearing early. Okay. POTS paraplegia has grading. Okay, grade 1, grade 2, grade 3, grade 4, as simple as that. So grade 1 means patient is unaware of his neural deficit. Okay, and you can detect that this guy has a Babinski positive, etc. Fine. And he has some patellar clonus. All this you can detect. But the patient is not aware that he has some neurological deficit. Okay, this is grade 1. So that is why when somebody is, you're suspecting them of tuberculosis of spine, you should now start looking for these neurological signs, right? Grade 2. The patient itself is complaining. He has clumsiness, incoordination, spasticity while walking, but he somehow manages to walk with or without support. Okay. Now coming to grade 3, he has severe weakness. Now he's saying he's not able to walk also. And then you will check. Then you will see that he has paraplegia in extension. There may be loss of sensation. Partial loss of sensation can be there. This one all you are eliciting, right? Patient only said that he's not at all able to walk. He has severe weakness. Okay. But you're seeing sensation loss also could be there, right? That is, you are checking that. Then let's go to grade 4. What do you think grade 4 is? Unable to walk. Has paraplegia inflection. So first paraplegia started in extension. Now paraplegia has gone to flexion also. There is near complete loss of sensation. He has complete loss of sensation in grade 4 with sphincter disturbances. Sphincter means what? He's not able to hold his pee and everything inside and his poop. So because his sphincters are also gone, because his spinal cord is compressed, infarcted. So basically he is not able to control his sphincters. Okay. So did you understand grade 1, grade 2, grade 3, grade 4 of what? Of POTS paraplegia. First of all, he is not aware. Secondly, he's having slight awareness. Then he's not able to walk. And finally, he has lost sensation and also sphincter control also doesn't have. That is the grading of POTS paraplegia. Remember, this is about the nerves. Now let's go to the treatment of POTS paraplegia. First, look at the investigations that you will do for POTS paraplegia. You will do a CT MRI. You will see that there is vertebral destruction, abscess. Then you will see that sequestra, etc. is there, pus. So all that you will know in this investigation. Right now, let us go to the treatment. First of all, we'll talk about the conservative treatment. What you will do for this guy? What conservative treatment do you want to give for this guy? Think about it. Anti-tubercular drugs, yes. So you will give isoniazid, rifampicin, pyrazinamide, ethambutol. All that you will give. What is that? HRZE for 2 months and HRE for 4 months. Very good. Then if that is, so if it's a drug sensitive, then you'll wait, you will put some sling traction, etc. Just wait for it to, the anti-tubercular drugs to work, right? So all this is basically for rest, okay? Let him rest and then you just check whether he's improving or not, okay? Then if he's not improving, then you can go to operative. Okay, now let us see operative, what and all you can do for POTS paraplegia. So you have to work on the vertebral column, remove the compression, right? So obviously anybody will say, what will you do for POTS spine, or you will do for POTS paraplegia? What will you do? Say. Decompression. Very good. So you will do anterolateral decompression, they are saying. Then there are so many types of decompression, looks like. Costotransverse ectomy. See this, so you see this transverse process, ectomy they have done. I think this they can do for posterior, right? Only if it is posterior. So you will remove a section of this rib and transverse process, not just the vertebra, they're talking about the rib also. They're removing a portion of the rib also, okay? Then, this they are doing if there is a tense abscess, okay? So they want to decompress. If there is tense abscess, okay? And where are we? You will remove rib and transverse process, okay? So what are you doing? A section of the rib, remove a section of rib and transverse process, okay? So what you will do? You will try to decompress. So in all cases it may not produce decompression. Then you may need an anterolateral decompression. Now what is anterolateral decompression? Look at this. Anterolateral, where is anterior? Anterior is here. Wait, let's draw anterior. Anterior is here, posterior is here. You will do anterolateral. So this will be lateral, yeah, both are lateral. Okay. So anterolateral decompression you are doing. So what are you removing here? Looks like you're removing a part of a vertebral body, transverse process, and the section of rib, right? And they are removing pedicle also. Yeah, pedicle also. So this is the most commonly performed operation they are saying. Then we should write it first, right? But they are removing more parts of the vertebra. So that's why they are writing it second, looks like. So this, you'll open the spine from the lateral side. The axis is made to the front and the side, okay? So here what and all you are doing, structures which and all you'll remove. You'll remove the section of the rib, the transverse process, the pedicle, and part of body of the vertebra. So what and all are you removing? Guys, for this you should know the anatomy, right? So transverse process, pedicle, part of vertebral body, and this section of rib. All this you are removing in anterolateral decompression, okay? This is most commonly actually practiced, they are saying, okay? What and all you are not removing here? You're not removing the lamina and the facet joints. You're not removing, okay? Where is lamina? If you remove those now, it will become very, very dangerous. It will like stability of the spine will go off. They say lamina is this one, right? This is the lamina. Lamina they are not removing, and they are not removing the facet joints. The joints they are not removing. What is facet joint? See how the inferior and superior processes articulate, right? That is the facet joint. That and all they are not touching, okay? So did you understand anterolateral decompression? This is the most commonly done, and they have written it second because they are removing more parts, right, of the vertebral body, vertebra, okay? Then last, third one here, radical debridement and orthodesis. See, debridement means you will just remove everything that's affected, right? Radically and around it you will also remove kind of a thing. And arthrodesis is you will fix the joint, right? He cannot move this joint. This is called as some Hong Kong operation. I think for now, if you just know the name, it's sufficient. However, if you want to know more about it, so basically you will remove all the dead and deceased vertebra. Dead and diseased vertebra they are removing, and they are putting some rib graft. So there will be some arthrodesis. Okay, this is Hong Kong operation. The best part about this is this person will have early healing and he will not progress into that kyphosis that you saw. Okay. Now coming to laminectomy. So laminectomy means what? Very easily you can understand this. You're removing the lamina kind of a thing. When will you do this? In spinal tumor syndrome. That means there is a granuloma there, right? You want to remove it. So they are doing laminectomy. Okay. So especially this is in posterior spinal. Yeah, we know that posterior only you have that lamina. So guys, please practice this diagram of vertebra. Okay, it will help a lot. So we have looked at POTS paraplegia, how you will fix. Okay, so how is the prognosis? Children will respond better. Okay, and acute onset paraplegia has better prognosis. Okay.